Hello, it's the 12th of November 2024. This is really just a video to prove I'm still alive. It's been a couple of months, I think, since my last video. So yeah, thank you for all the kind messages for my birthday last month, and the recent messages as well. And particularly thank you so much for the donations. So I'm now halfway towards paying for the next 2 rounds of immunotherapy, which may keep the cancer under control for a bit longer. So yeah, I really appreciate the donations and messages and all those things. So yeah, things have been very difficult health-wise recently, just from the side effects of the chemo regime I'm on, and also the side effects of the side effect medicines. The drug I'm on at the moment, called Lonsurf, which I take with another drug called Avastin, it usually causes very severe fatigue, and I seem to be getting like the very extreme level of fatigue pretty much all the time. Although actually I've now worked out some of the fatigue is due to the side effect medicines I've been given to alleviate the side effects of Lonsurf. So the protocol I'm on, you have a drip at the hospital, and that's a drip of Avastin, and then 5 days of chemotherapy every day at home, and 2 days off, and then another Avastin drip at the hospital, then 5 days of chemotherapy every day at home, and then 2 weeks off, and then the cycle repeats. But in the sort of 2 week off period, that's when the bone marrow suppression is at the highest. So your body feels very heavy and the fatigue is very extreme. A major effect of Lonsurf is appetite suppression, so it's a real struggle to eat. It also makes you want to be sick, so it causes a lot of nausea. And I've been given anti-nausea medicine, which helps, but it has its own side effects. So it causes stomach issues, abdominal pain, sleep problems as well, because of how the anti-nausea medicine works. So it sort of inhibits nerve pathways between your brain and your intestines. So this causes issues with your intestines and your stomach, and also a lot of discomfort at night. I've been given sleeping pills to try and let me sleep through the night, as I usually wake up every few hours due to the chemo side effects. Unfortunately, the chemo pills cause a lot of fatigue during the daytime. Lonsurf, the chemotherapy drug, causes fatigue as well. So I've now given up on the sleeping pills. I've tried different pills, I've tried different doses, but it's better just to have, it's better to have rough nights but less fatigue during the day, because at least then I can get some stuff done during the day. I'm still trying to get into a clinical trial, or any clinical trial. I looked into a treatment for my liver tumour. So I've got a 21mm liver tumour at the moment, and there's a treatment I could have, which is chemotherapy directly to the liver tumour using a sort of pipe that's forced up through a blood vessel in your leg. But because of the position of the liver tumour, it's in segment S1 of the liver, which is kind of the middle part. It's not clear whether there would be a good blood vessel into the tumour. About 30% of people have a certain blood vessel present in the segment S1 of the liver that can be used, but yeah, I would need to have a special type of scan to see if that blood vessel is present. It wasn't visible on a normal CT scan, but there's a special type of CT scan you can do with where they inject dye into your leg and it moves up through the blood vessels into the liver, and they can the interventional radiologist can see the pathways and see if there's a good route into the tumour. So that's a possibility, but that's just a local treatment, so it wouldn't do anything for all the lung tumours and the tumours in the various lymph nodes in the para-aortic lymph nodes. It's kind of around the abdominal aorta, and then there's some cancer in the place where the bronchus just begins, and then there's also I can't really feel it, but the lymph node under the collarbone on the left hand side, which is about 15 millimeters big at the moment. So there's a bunch of cancer, and the reason I was looking into the liver tumour treatment was it may make it easier to get into certain clinical trials. Yesterday, when I went to the specialist cancer hospital to talk again about the clinical trials and show them the results of my recent CT scan, a doctor was saying that the trials they've had recently don't have any exclusion criteria to do with the liver tumours, so I don't need to kind of be too concerned about that at the moment. However, he did say that basically the policy is you shouldn't go in a trial if your current treatment is keeping the cancer stable. Currently my cancer seems to be stable, although it is difficult to tell because of the positions and sizes of the various tumours. It's difficult to see change. And it would just be that if the policy is that you have to wait until your current treatment is not working, he said you'd need to see sort of growth of 20% or some new tumours appearing, and then you'd be eligible to go in a trial. Obviously I'm not going to do that. That would be so stupid because if the cancer's growing, it can potentially kill me. I mean, just for example, the tumour in the I can't really see on the camera, but like where the bronchus just begins, if that tumour starts growing, it's going to push on my esophagus and make eating difficult, make breathing a bit uncomfortable. And the longer I stick with the chemotherapy, the more chance there is of something really bad happening, like heart attack or kidney failure or liver failure or whatever, or just being killed by an infection because of being immune compromised all the time from the chemo. So obviously stupid to wait for the chemo to stop working, and and I mean I'm having other treatments as well, like thanks to your donations I've had some immunotherapy a couple of months ago. I'm doing the hypothermia therapy usually 2, maybe 3 times a month, and it's a suicidal pathway to wait until my body is completely riddled with cancer before trying a new treatment. So when I really kind of pushed the doctor on this, and he admitted it's ridiculous and dangerous. He then said, well, another way to get in to be eligible for trial is if you can't tolerate your current treatment. And because I've had like the very high, like what's called grade 3 fatigue, so fatigue so bad that you've had to reduce the dose of the treatment, and also I've had grade 3 neutropenia, which, or maybe grade 2 neutropenia, so again like the very low white blood cell count, meaning I've had to go on to a lower dose of chemo. These things happening should allow me to potentially get in a trial on the grounds that the current treatment is too difficult or dangerous to continue. So potentially I can get into a trial. Then of course there is whether there is a suitable trial, and then there is, for each individual trial, there are inclusion criteria, so who's allowed in potentially, and then the exclusion criteria. And when I was showing my blood test results to this trials doctor, he saw that my platelet count is often very low. It should be like 140,000 platelets per microliter of blood, or whatever the unit is. And so it should be like 140,000 to I can't remember, maybe 270,000 or something. And mine is like usually 80,000 or something. And he said, oh well, actually to do any trial you would need 100,000 platelet count, and mine is sometimes around that level, so that's still low, right? They're still below the safe level of 140,000. But yeah, so it would be a question of just hoping that when I stop the chemo, because you have to stop for like a few weeks before you start any trial, which is called the washout period, hopefully the platelet count would go up a little bit. My platelet count has not been normal for at least like 4 years now because of damage from just the first few chemotherapy treatments I did. I took a drug called oxaliplatin, which causes scarring inside your liver, and that has caused a low platelet count. So potentially, anyway, there is a trial I could get into. Possibly, this is not really an immunotherapy, but something to maybe activate the immune system a bit. So sort of pseudo-immunotherapy, I guess. It's you do a drip once a week for 4 weeks, and then once every 2 weeks from then on. The first 2 drips have to be done in hospital, and they don't let you go home in between, so you've got sort of 8 or 9 days in hospital, which is frustrating and unpleasant, but still. So that's where I am at the moment, is fighting to try and get in the trial. Next week is when the next cycle of chemo is due to start. It may be I just can't have it based on the blood test result, so sometimes my white blood cell count has been too low. Sometimes I can't have the Avastin because of kidney damage. If the test result's okay, then I have to kind of think, do I want to do another round of this toxic chemo? So that's just my situation at the moment, really. On a far more positive note, the NPO that I set up with a few friends, we've finally got registered in July. Got approved by the Japanese government, and since then things have been rapidly moving forward, which is just incredible. We've got, I think, 15 volunteers now. So there's like 15 volunteers and then the officers and some helpers. So we've got sort of 22 people working on a couple of big projects at the moment. So one project is to improve the quality of life for patients taking chemotherapy. It's a very simple project, so just preparing cancer care packages. These are packages with probably sort of 10 items in that people on chemo need. So things like various skin creams, hard candy to suck because you get a lot of mouth trouble, and of course if you're having trouble eating, then candy gives you much needed energy. An eye mask, so you may be able to get some rest in the brightly lit hospital. Yeah, just a bunch of useful stuff. So the plan is to deliver thousands of them, but initially we're doing a pilot scheme of just 100, and they'll everyone will have like a feedback form, so we'll ask the patients to use the things in the care package, and a couple of weeks later let us know what was useful, what was not so useful, what they wish had been included, and then we'll start rolling out those packages on a bigger scale. So that's one project. Another project we're working on at the moment is to run the first of like a cancer education day for patients and carers. So this will be for about 150 people. It'll be a one-day event with talks from various specialists, but the talks will be, some will be medical, some will be just things that cancer patients need to know about, but the medical ones will be only topics that are useful for all cancer patients. So there'll be ones about how to access clinical trials, for example, or maybe managing side effects of treatments. But there'll be broad topics that are of use to all cancer patients. So those two things are happening at the moment. We've been doing a lot of training sessions and planning with the volunteers, and working on some fundraising too. So that's been really fantastic, and it's likely that we're just going to continue growing, and hopefully by spring next year we'll be the biggest non-profit in Japan working on cancer, and we'll start doing some really big ambitious projects and saving lives, really. So, I mean, the aim of the non-profit, the primary goal is just reduce the deaths from cancer initially in Japan, but make a model that can be copied by other countries. Secondary goal is improve the quality of life for cancer patients. So things like cancer care package isn't going to save anyone's life, but it should improve the quality of life, and also it's a really good way for us to get connected with hospitals, doctors, nurses, and with cancer patients and their families themselves. So I think a very worthwhile project. As usual, thank you so much for caring enough to watch my videos, and I really do appreciate the messages and the donations, and if you can share my donation link, then it makes a huge difference, because as I said at the start of the video, I'm now halfway to covering the costs for the next 2 cycles of immunotherapy, which could be very significant. So thank you so much, and please share my donation link. Goodbye.